that patients who had eyebrow and forehead lifts reported that their migraine headaches disappeared. Heather Unruh says the result is a treatment that is bringing relief to some long-pained patients.
Which version? Danger one? Okay.
Jannelle Chiaffi is a full-time mother and a full-time employee. 3 years ago, it became nearly impossible for her to do either of those jobs. The reason? The sudden onset of constant and severe migraine headaches.
They started December 26, 2009. I know that because we ended up in the emergency room the day after Christmas. And they didn't know what was wrong. And that was the first time that it was just, I couldn't get up off the couch. I couldn't do anything.
Within a month, Jannelle was under the care of a top neurologist who prescribed several remedies.
Change my diet, go off caffeine, go off chocolate, don't eat processed foods, eat healthy, better sleep patterns. I tried everything.
She was also prescribed a number of drugs, including painkillers and antidepressants.
I didn't like the way the antidepressants worked. I mean, if I forgot to take it, the headache was worse. Pain pills would take the edge off, but it would never make the headache go away. And then I would just live in a fog. And I didn't like, with 3 kids, you can't live in a fog like that.
Months later, Jannelle heard about a new treatment for migraines available at Mass General Hospital. Dr. Jay Austin was using plastic surgery techniques on patients with severe migraines for whom other remedies had failed.
What we're finding is that the nerves around their face or neck are being irritated, compressed, or stimulated in some way to instigate these events. And once we can show that those triggers are involved and that if we block those triggers, their migraines go away, then we consider either decompressing or removing those nerves.
Patients typically have 2 surgeries, one at the base of the neck, the other around the forehead. Stacy Sachs of Florida had her first surgery a year ago, and her migraines went from 15 a month to just 3.
You've been pretty happy with your results.
I've been thrilled. Dr. Austin is like a miracle worker.
Now, Stacy is back for her second procedure.
Dr. Austin is zeroing in on a nerve he thinks is critical here.
Almost certainly a migraine trigger.
The nerve is being sandwiched by a fascial plane. So it's a tight, leathery band of tissue that's compressing the nerve right on the muscle.
6 months after Operation 2, Stacy reports from Florida she is basically migraine-free.
It has changed my life completely.
As for Jannelle Chiaffi, she had her second surgery in late October.
The second surgery was a little tougher because it's your face. They did incisions on the top of each eyelid, and they went in and they released the nerves here, and they severed this nerve here. The muscles here are similar to what they do for like a forehead lift, so I'm now wrinkle-free. I look like I went 10 rounds with somebody. I mean, the bruises were unbelievable.
But so was the relief from oppressive pain.
Totally gone. Totally went away. I haven't had to take Motrin, Advil, Tylenol since October 24th. It gave me my life back. You know, my kids say I'm not grumpy anymore. My husband says I'm not as grumpy either.
Dr. Austin says that even though the procedure has been around for over a decade, it wasn't until a year ago that insurance companies began to cover it. He says he expects to do many more of these operations in the future.
There is nothing as satisfying as curing someone's pain. And these patients are extremely pleased and happy, and you feel great for them when they get better.
Remarkable. Surgery, of course,